Hi, I'm Marvin Plackett, and today is Thursday, December 10th. Greetings to all residents, to all staff, and to all guests, friends around the world. We currently have 22 active COVID cases at this time. So if your memory is good, you will realize that over the last 3 weeks, we have been slowly climbing in numbers. And that is disconcerting, or that is very concerning for us and disconcerting. We certainly don't like to see it decline. We like to see it we want to see it decline, not increase. And we've been seeing that slow increase. And you know, it's in large part a reflection of our society. The surge is just increasing around us. So that means that COVID-19 is knocking at our door at all times. And so we really need to be doing our part. I'm actually, believe it or not, rather pleased that our count is 22 because there are many long-term care organizations where the count is far worse, and especially when COVID-19 is surging around us like it is at this time in the state of Minnesota and really throughout the country. But we're working hard to see a decrease, not an increase. So those 22 active cases at this time, 13 are residents and 9 are staff. The 13 residents, they are at Episcopal Church Home or at Iris Park Commons or at Carty Heights. And the ones at Episcopal Church Home, they are in our dedicated COVID unit, and at Carty Heights and Iris Park Commons, they of course are quarantined in their apartment, okay? And the staff, of course, are at home recovering. So 22, and we sure hope that that number starts to decrease here very soon. I also want to read a short message from Keenan. Keenan Franco is the administrator of the gardens. So in addition to these 22 that I just referenced, there's one more. We discovered a healthcare provider, and that is somebody who's not on our staff, but they come in and provide services to one of our residents. So we discovered that a healthcare provider tested positive today and last visited Walter House 2 days ago, on Tuesday. Walter House, that's one of the houses in the gardens. We do not believe any other exposure occurred, and we will continue to test all elders and all staff, okay? And of course, the testing is occurring with great vigilance at Episcopal Church Home, at the Gardens, and Iris Park Commons, where it's occurring every week. And in some cases, more than once a week. It's twice a week. So there's a lot of testing. And of course, if there's a new case, well, then there's immediately testing that occurs based on the contact tracing. Remember that on our website, which is episcopalhomes.org, that is always where you can get the latest information, the latest statistics on our COVID situation. Okay, where the positive cases are, what the numbers are at any given time, and that website is updated every day. So that's a valuable site. A vaccine, it's in the news all the time. And the vaccine is, in Minnesota, it's going to be distributed to those that are in long-term care, and the state of Minnesota defines that as those in nursing homes and those that are in assisted living. So nursing homes and assisted living. Those residents will get it first, immediately followed then by the healthcare workers. And so obviously our organization is a priority, but it's, in the high priority, they're still in order. So we don't have all the details yet, but they will be forthcoming in the not too distant future, because the vaccine is theoretically going to be distributed yet this month, towards the end of the month. So it's already the 10th, so it's not far away. We're watching every day for updates from the health department, additional guidance as to when, where, and you will promptly be informed, of course, not just through this twice a week update, but also in writing. Governor Walz said just 2 days ago that we are at the worst point in the pandemic right now. And the statistics, the experts would support that. Jan Malcolm, the healthcare commissioner, the Minnesota Department of Health commissioner, she certainly has said that also. So the experts nationally and here in the state of Minnesota, we're at the worst part of the pandemic right now. So now is the time, even though there's a vaccine on the near horizon, now's the time to double down on the little steps that we know to take at all times. It's not a time to get cavalier or to start to get careless because a vaccine is just around the corner. It is just around the corner, depending on how long you define the corner, right? And of course, in society in general, while long-term care may be first, how long before it gets through everybody in our society? That's several months down the road is what I'm reading and hearing. So we are at a very tough spot here for the next few months. So we have to double down on always wearing our masks when we're not in our rooms or in our apartments. Staying at least 6 feet apart, the physical distancing, washing our hands frequently, and if you have any symptoms, because I still occasionally hear people say, well, I didn't think I had it, I just thought I had a cold. If you have symptoms like a cold, you need to isolate and you need to get tested because you might be positive, because as you know, there's a full range of symptoms. And then of course, there's a significant portion that have no symptoms, and that's why we have to always be practicing, every single one of us, wearing our face masks at all times, physical distancing of at least 6 feet apart, frequent hand washing. And if you have any symptoms at all, isolate, get tested, okay? Those are really key things. Wouldn't it be sad if you got in trouble right at this point out of carelessness, or you got somebody else in trouble with COVID out of carelessness when we're so close to a vaccine? Let's not do that. We can see light at the end of the tunnel. Let's double down on our vigilance in the meantime, because we're at the worst point right now, the toughest spot. Okay, enough preaching. All right, so I will not see you until Monday, of course, and I look forward to that. And now to wrap things up for today, our Joy Ambassador, one of my favorite people, lives at the Terrace, Dusty Mars.
First, I want to express appreciation to Marvin for keeping us so well informed about our lives together during this very difficult time. His messages help us understand the what and why of the pandemic for us here at Episcopal Homes, and how we each have the responsibility to help ourselves and to help each other. I am Dusty Mars. I've been a Terrace resident for as long as the Terrace has existed. We are starting our 7th year together. I am also an owl from St. John the Evangelist Episcopal Church in St. Paul. As owls, over the past few years, we've been recipients of a staff-hosted lunch and program 3 or 4 times a year. Staff planned, provided, served, and cleaned up for a room full of us owls. It's fascinating to see rectors cooking, sextons setting table, organists pouring coffee, administrators, children's ministers, youth ministers serving each person, assistant rectors filling the dishwasher, all working together to put on an owl lunch and program for us older, wiser laity. St. John's hasn't forgotten us these past 10 months. Twice since March, they've provided us with bags of goodies, plants, and a collection of poems, prayers, and pictures compiled by our Reverend Barbara Morales. It's from this collection that I found the dismissal that we use at the end of each service, or we did 10 months ago when we were last gathered. Reading it now still presents a charge for us wherever we are. This is the dismissal. Our worship here has ended, and now let our service begin. Go forth into the world and know there are words of compassion and courage that will never be spoken unless you speak them, and deeds of compassion and courage that will never be done unless you do them. Know that you were created not for happiness, but for joy, and joy comes to them alone who commit themselves in love to their brothers and sisters. Go forth in peace to love and serve the Lord. And today I could add, peace be with us all here at Episcopal Homes.